Hi, I'm Dr. Erin Ducat with Ducat Chiropractic and Sports Medicine here in Bloomingdale. Today we're going to be talking about one of the most common conditions I see in my office, and that is upper back and shoulder pain. This happens a lot to individuals who either work at a computer all day, maybe do a lot of cooking, sewing, cleaning, things in that forward position. Also affects a lot of new moms and breastfeeding moms too, because they're constantly holding and supporting a baby. So when these type of patients come to my office, one of the tests I usually do on their first day is something called the wall angel. And this is something that you can do at home just to analyze your posture and see how flexible your neck, shoulders, and upper back really are. So to do a wall angel, all you need is an open wall, like this one, and you stand with your back to the wall, and your feet can be, let's say, within about 4 to 5 inches away from the wall. Then you want to make sure your elbows are at 90-degree angles, and then try to make sure your upper back, the back of your head, your shoulders, your elbows, and your wrists, and all 5 fingers touch the wall all at the same time. There's 2 spots in your back that shouldn't touch. That's the small of your back and the small of your neck. Everything else should be touching. Now, for most of you, when you test this out, especially if you have upper back pain or shoulder pain, you're going to see one of these different scenarios. You may find that you can't get your hands back, or you maybe just be able to get your fingers back but not your wrists. This indicates that the front of your shoulder is really tight. Maybe you can get your wrist back, but you can feel that your upper back, from here to here, all that isn't touching. It's kind of either or situation. Either your middle back is sticking out like this, or your upper back is coming forward like that. That indicates that you have a lot of tightness here in your upper back. The last possible scenario is that you can't get your head back. Maybe it's stuck forward, kind of like this. We call this a forward head posture. A lot of times that's going to come along with the tight shoulder and the tight upper back. So you may see all these 3 scenarios all at the same time. A really useful stretch that you can actually try at home before coming to the chiropractor to help self-treat your upper back or shoulder pain is something called the open book. So I want to take you guys with me down here to the floor, and let me show you how to do open book. All right. So to do an open book, you're going to lay on your side, just like this. Your hips are going to be bent at 90 degrees, your knees are going to be bent at 90 degrees, and I want you to take your hand and actually hold your knees down like this, okay? Then rest your head on the ground, and you'll start with your hand like this. We call this the closed book. Then, keeping your legs on the ground, you're going to follow your hand with your eyes and your nose, and you're going to rotate open just like that, as far as you can go, and then you're going to come back. And then you repeat this nice and slow, maybe 6 to 10 times. There's no exact amount for reps. There's no exercise police coming to your house. Just do it until it feels good. This exercise helps stretch the thoracic spine, your rib cage, your shoulder, and your neck all in one fell swoop. So it makes it an excellent choice if you can't pass that wall angel test. Now, if you have continued pain after even trying this stretch or need some professional help, I'd be happy to assist. Just check out my website. We're at ducatchiropractic.com. Thanks.